Good afternoon, ladies and gentlemen. I'm Pei Fen Xie from the Taiwan ICDF. Let me try to, yes. Being one of the very few people in this room who is not an expert in public health and medicine, I guess I will approach this topic from some examples of our medical diplomacy practices. Today I will first very quickly go through Taiwan ICDF's smart health strategies, and I will spend more time in giving you examples in our projects in Latin America, in the Caribbean, in the Pacific, and in Africa, and the lessons we have learned from our work there. So, as Director Shi has very kindly introduced to you, Taiwan ICDF is Taiwan's ODA agency. So what we do is we draw on our Taiwan's comparative advantages to respond to our partners' needs, partner countries' needs. So one of the comparative advantages we have as a country is medicine and public health. And another one is ICT. So we combine these two to carry out our public health, our smart health projects around the world. So we currently have 22 missions in 21 countries. So these are the map of where we are. And so today I will go into more details into the projects we carry out around the world. So the smart health strategies we employ, basically there are 3 pillars. So the first one is smart monitoring systems. So we have established the health information system and the very basic of a health information system and more advanced applications in Paraguay and in Somaliland. And the second one is the health management applications. So we have projects in Fiji, and that is the first such app in Fiji, and also in St. Lucia. And also the third pillar is data integration and analysis using AI. So for this one, I will give you examples in Belize and Somaliland. The first one is the smart monitoring systems. So as I mentioned, we have projects in Paraguay and Somaliland. And I will give you an example in Paraguay because this one has been a very successful case in our history. So before 2016, in Paraguay, all of the medical records are handwritten. So this causes duplication, omissions, delays in data collection and data analysis. So in 2016, we intervened. We started this project with the Paraguay government to implement the health information system in the country. Actually, before we intervened, there were quite a few other donor countries and international organizations who have proposed to the country to implement such projects, but they all failed. So compared to what they did was they simply transplanted their own system to Paraguay. For example, the system in their home country might be English, so they translate English into Spanish and give that to the Paraguayan hospitals. But what we did was we started from scratch. Our team went to the very front line to talk to the admin staffers, to talk to the nurses, to talk to the doctors, to understand the procedures, and also to understand their cultures, to understand their habits, to understand their practices. So in the very beginning, to be very honest, the government was very suspicious. The host country government was very suspicious. So they gave us 3 hospitals in 3 more remote provinces to try on this project. But just within 1 year, we developed his health information system that's very friendly to the users. And the Paraguayan Ministry of Public Health asked us to go to the capital city, Asunción, to roll out the health information system. And as of now, we have already installed our health information system in over 1,100 public health facilities in the country. It's about more than 90% of the public health facilities in the country. And the last 10% is like in very remote areas. But we are still trying very hard to even roll out our health information system in those areas, and which covers over 75% of the population. But we not only install the health information system, the system itself, but we also train the people, train the medical personnel, because we think it's very important not only the hardware works, but also the software, the knowledge, the capacity can be built. So in terms of our achievements, I guess we can see our achievements from 3 different perspectives. So the first one is hospital management or hospital governance. So before, because of the delay in data collection, in handwritten data collection, there's always mistakes, there's inefficiency in the process. But now with the real-time collection of data, so everything can be shown on the screen in the manager's room, in the hospital, or in the Ministry of Public Health. As you can see, I guess, I don't read Spanish. I guess probably not many people in this room read Spanish, but as you can see, it's very intuitive, like 6 area, and like services, different departments, and also like different doctors. It can be very clear about the situation in one hospital. Like for example, like one single hospital, they see their own data in their own hospital, but for like the ministry, they see the data from all over the country. And another achievement is from public health perspective. So as you can see, the second photo is the dashboards. So we have developed over 30 types of visualization on the dashboard, and it can be refreshed. It is refreshing every 5 minutes. I just went to Paraguay in September, and I saw it myself. It's very impressive. And also, we combine the health information system with with GIS, with the geographical data to identify the areas where the communicable diseases are at high risk. For example, dengue fever is also a very serious problem in the country. So with this system, the government is able to see which areas can be the hotspots, and they can take preventive precautions measures beforehand. And the third achievement of the system is that before, when you go to the hospital, you give the staffer your name, and they went to the storage room to find your medical records. Sometimes they found it, sometimes they don't. And then pre-consultation, consultation, and when the physician is writes your prescription, and you take the prescription to the pharmacy, and the pharmacy tells you that the medicine is no longer available. So you go back to the physician to ask for another prescription. So that goes on and forth. But then now the whole process, the waiting time reduces from about 3 hours to 30 minutes because the whole process is digitalized. Now you only need to take your ID card to the hospital, and then your whole medical records can be shown on the screen. So this is, makes the whole process of providing and receiving healthcare a more pleasant experiences for both sides, or more comfortable experiences for both sides. And so this is one of the very successful projects in our medical diplomacy, because usually for public health projects, it doesn't take that long. This one, this is the 9th year already, and we are expected to conclude this project in 2028, the 3rd phase of this project. And that will, our goal is to cover 100% of public facilities in the country. And the second type of smart health projects that I would like to share with you is our health management apps. And this one in Fiji is especially recent and has achieved quite a lot. This was actually a one-year project, a pilot project we started last year. We work with USAID. For those of you who are not familiar with Taiwan ICDF, our US counterpart used to be USAID. Our Japanese counterpart is JICA. So we work with USAID and the Ministry of Public Health in Fiji to strengthen the capacity of primary health care workers. Because in the country, in many rural areas, the internet connection might not necessarily always available. So when the primary health care providers go to home visit the patients, they used to have to carry all the medical handwritten records with them. And that can cause us a lot of problems. But now we have developed this app for them. So before they leave the health center, they can simply download the records on their devices. And when they go home visit the patients in probably more remote areas, they can write on the devices. And when they go back to the health center, they can upload the data. So everything can be more smoothly and the records can be kept. And with this system, this is the first digital tool for primary health care in the country. So with this system, we are also able to develop follow-up alert systems. For example, we send reminders for missed visits, and also similar to our cases in Paraguay, we also combine the health information with GIS, so to find the hotspots of certain diseases, for example. And this is the user feedback. So we have, in 1 year, as of May this year, we have recorded over 12,000 patients with 170 active users. So the active users are primary health care providers, not patients. So it's not a big country, but so this is already quite something there. So the third type of projects I would like to introduce to you is our data integration and analysis works using AI. So one case is in Belize. In Belize, 43% of deaths are caused by NCDs. And one major NCD is diabetes. However, as you all know, that diabetic retinopathy may lose sight. But the thing is, the country only has one eye specialist, one eye doctor in the country. So that can be a problem, a huge problem. So what we did was we introduced the AI diagnosis application called VeriCDR, developed by Taiwanese company Acer, to help general physicians to detect early the relevant symptoms so they can alert the patients earlier, and then they can prevent the diabetic retinopathy more earlier. So this is our work in Belize. And last but not least is our work in Africa, in Somaliland. Somaliland is different from Somalia. Somaliland is an area that is in need of more medical services. So what we introduced there is AI-generated EMR in the country. As we all know, doctors' handwriting can sometimes be very creative, can be very artistic. So the thing also happened in Somaliland. And the thing is, in Somaliland, the official language is English, but the spelling and grammar can sometimes not be standardized. So what we did with the EMR, the AI-generated EMR, is that we help improve the efficiency documentation, and we reduce language errors. So that helps other physicians to identify what happened with this patient. So this one is a very recent case we did in Somaliland. We work with the Wharton School of UPenn in America, in Somaliland. So the lessons learned, we have we have been learning from all of our projects, to be very honest. We have learned 4 lessons. So one is what we have heard over and over again this morning, like from DG Dr. Low, from Professor Wang, mutual trust. Trust is very important. So what we did in Paraguay is a very good example. Other donor countries, they think their technology is better. Actually, their technology is very good, but it may not be suitable for Paraguay. So mutual trust is very important. And also design based on local needs. We work with the local people, with the people who actually use the system, use the tool, because we understand that our projects may end, but the people, the users, will continue to use the system, to use this tool. And also we build with them, and we also let the partner countries, our partner institutions own the system. So this way, our projects, the impacts, the benefits of our projects can be sustainable. So that's it, and thank you very much.